Welcome back to the debate room. I'm Guylaine Boddington, one of the co-curators of FutureFest, and I'm here to introduce a session called Machines That Care for Us. And Machines That Care for Us, we're looking at personal and collective devices supporting our welfare needs. So it's all about our care in the future of our bodies, of ourselves, and what is going to happen in the next 10 to 20 years.
So, Hannah, Alan, the stage is yours now. If you just want to kind of start by giving us your deposition, as it were, of where we are in this whole debate about machines that care for us.
Around 1,000 women every single day are dying from preventable and treatable conditions related to antenatal and postnatal stages of health. Just over 20 children and babies are dying on a global scale, and 99% of these are happening in developing countries. This is the world that we're living in, and yes, we're very lucky in the UK to have access to an amazing healthcare free at the point of care, but in other remote settings, they don't have that access to the resources that they need. And we need, this needs to be our problem. This needs to be on everybody's agenda, and everybody needs to be thinking about this. And when, within the context of this panel, Machines That Care for Us, I think we all need to be thinking about how we can create the technology that we need in order to enable the people in remote settings to be able to access the healthcare that they need when they need it. And I think that that is something to get really excited about, and particularly from a maternal health perspective. The maternal mortality ratio is unacceptably high globally, and it should be all of our issue and all of our problems. And I think the future, we're focusing on the future. We're thinking about futuristic elements here. Where do we see the future standing? I think that with amazing data analytics, predictives, with the ability to visualize ourselves in a different form, such as the digital twin work that we're doing and avatar work, I think that that is really, really fascinating and really, really exciting, and we'll explore it a little bit more later. But I think this is all very relevant to you guys. You're the youth, you're living this, you're going to be embracing this technology. This is your future. So become a part of this and join in on the debate and get excited about it, because I am.
And I can tell you from what I've seen that VR is powerful. I've seen people's moods completely transformed. I've heard about VR pieces that have given people moments that I think I can probably only describe as spiritual. And personally, I've done some VR content as well in the wrong context that's felt horrible and has maybe not even recognized my own body as my own. So this afternoon, I will focus on VR's ability to care, or in some cases, to not care. In this debate, I'll touch on VR for care, for therapy, for medicine and health, and as a bracket, I will just call this caring VR. And I want to make two main points now. So first of all, hundreds of studies over the decades have shown that virtual reality has a transformative power. VR is, at its heart, one grand illusion, and it's a powerful illusion. You strap a screen onto your face, and it kids your mind into thinking, and your body into thinking that you're somewhere else or at another time. It makes boundaries of space and time much less relevant. It really is human experience bottled. And that human experience, when it's being made, can be tested and optimized and A/B tested again to have a specific effect on its user. For instance, VR has been proven as a visualization tool to help relieve pain, and in fact, it's now being rolled out over hospitals in France. Patient VR is a VR project. This is another example from Torbay and Devon's NHS Trust, and they've been using it regularly for years to show hospital staff what it's like to be one of their patients, and to also preview certain procedures for patients to help relieve anxiety. And then also another great example is the company Immersive Rehab, who are a startup that I've mentored. They provide fun games and activities in virtual reality for the purpose of rehabilitating people who've had spinal injuries. I have countless more examples. I don't really have time to go into it, but VR doing things, for instance, fighting phobias, treating depression, even as a tool to help people walk again. And I can tell you it works. It's powerful. We have this new superpower on our hands, and that's pretty exciting. But here's my second point, to use that quote from Spider-Man, with great power comes great responsibility. With caring virtual reality, our audience are often at their most vulnerable. Virtual reality asks any user to surrender their senses in the physical world and instead prioritize the senses in a virtual one. that requires people to feel quite vulnerable in their physical space. So bring into the picture the fact that these people are often in the most vulnerable situations you could imagine. They are people in need of care, and we really need to take this responsibility seriously. We have to treat this medium with a duty of care. So with all this enthusiasm that we have at the moment for the transformative effects of virtual reality, well, we should get equally as excited as things like risk assessment, or countering unconscious bias, or testing, or transparency, ethical policies. We have to get equally excited about this as we do about the super cool end product. And I suppose the good news is, just to wrap up, is that although caring virtual reality has been used and researched by academia and hospitals for actually decades, when you zoom out and look at the big picture, it's still early days. And that means that this emerging industry is still malleable. It can be shaped. So now is the time to be having discussions like this one. Thank you.
I'm not neutral. I think robots can be a force for good in our lives and in healthcare. I want to talk about two things. One is aging and long-livedness, and the second thing is loneliness, and I'll briefly touch on this notion of how we can connect everybody up. So, who here owns a robot? Anybody?
Right, so we're looking around.
Not many.
Hands going up.
I can see a couple of hands. Who here owns an automatic washing machine? Aha. So what you don't realize, I think, is that the modern automatic washing machine is indeed a robot. It has a motor that spins the clothes, and it has a bunch of sensors that measure the dirt in the water, the temperature, and decide whether the clothes are clean or not, and it can then dry them. And all of this is things that robots do. Robots measure, they perceive, they sense the world, and then they act in the world. And that's the difference between robots and telehealth and even virtual reality to some extent. If you want to physically act in the world to help people using technology, you have to have something like a robot. And that's, I think, what the robots of healthcare will be like in the future. We've got a robot here, Pepper, which is a humanoid robot. So I don't think future robots for healthcare will be robot butlers. I don't think there'll be these large human-like robots asking you if you need help. They will be robotic pieces of furniture. You might have a more robotic bathroom. If you live in Japan right now, you might already have a robotic toilet. They're less popular here, but they're catching on. And if you have a disability, this might be something that's very useful to you. And if you talk to people with disability, they talk about toileting as being one of the things where they don't want a human carer. They want to have a piece of technology which will help them do that. So the truth is that we're living longer, which is fantastic news for all of us. The sad thing is that as we get older, we're more likely to have a chronic condition. So I think 18% of us are disabled, but if you're over 65, 44% of us have some kind of long-term disabling condition. So the challenge is that as the number of older people increases, and I think it's now about 12 million over 65s in the UK, it's going up to about 19 million by 2045. That puts pressure on the younger people to care for the older people. So it's actually up to those people who are going to be older, and that includes me, to think about how we can look after ourselves and how we can use enabling tech to look after ourselves. So that's my goal with robots, is to create robots that can physically help us in the home to live for longer. So I want to say briefly about loneliness. So the main objection I hear about robots in healthcare is that they're going to replace people, which is the story we hear about robots in work and everywhere else. Well, it's more complex than that. It's much more nuanced. Loneliness is a serious problem, not just for older people. Actually, if you look at who describes themselves as most lonely, it can be the under 35s that can say that they're the most chronically lonely. But 1 in 10 of us describes ourselves as extremely lonely. If you ask older people, I think a third of them will say they don't see anybody from day to day. And many of them will say that their best friend is the television. So loneliness is a challenge that we have. It has negative health effects, being compared to smoking 19 cigarettes a day. So if you could reduce the experience of loneliness, you could improve human health. So, and this is the controversial bit, could you have a robot friend? And my answer is that robots can provide a form of friendship in the way that the radio provides friendship and companionship. A robot, a social robot, can provide an alternative to human companionship. And actually what it can do is it can break that negative cycle of loss of self-confidence, feeling of low self-worth, which stops you from going out and interacting with people. So if you have a social robot that can scaffold your social skills, make you feel good about yourselves, then you can make more human friends. So I finally say something about connecting ourselves. So some people are interested in this idea that we will interface ourselves with technology and become cyborgs. And I think, actually, everybody here, I imagine, has a mobile device of some sort in their pockets. And let me tell you, that's already interfaced into your brain. You probably have heard the stories about every time you get a thumbs up on Facebook, that releases a small amount of dopamine in your brain. So we don't need an actual physical interface to the brain for the technology to be talking directly into your brain. It does so through your retina, which is part of your brain, through your skin, which is full of nerves and so on. So we're already cyborgs. So we can look forward to a future where we become more cyborg-like, where we're closer to our machines. And I think that's where we're going. And we can talk about whether that's good or bad or not.
Tony, as you were on your feet there, let's talk about empathy. That's such an important subject. And after all, the title of this discussion is Machines That Care for Us. So what about, I mean, can a robot care? A philosophical question, but something that might not be sentient. Or does it necessarily matter whether it has a sense of itself and therefore is able to care for us, Tony?
Well, there's two things. Can a robot have a sense of self? I think right now robots don't have a sense of self. Part of my research program is to see if we could build a sense of self for robots. Now, that might sound scary, but I'll tell you why having a sense of self is good for robots. For one thing, they would know that they were a thing. They would know that you were a thing, a social thing they could interact with. They would know they would have bodies. They could be safer around you because they know they have bodies. All these things we do because we're selves. So I'm interested in giving this sense of self to a robot. Now, that robot might be able to understand what emotion was and therefore have some kind of empathy. Right now, robots really don't know there's a world out there, so they can't have empathy. But they can impersonate, if you like, or show emotion in a way that people find rewarding. So one of the things is you'll watch a television show and you'll have an emotional response to that. It won't worry you that that was generated by actors and it was filmed some time ago, and that they're not reciprocating your emotion. So you can have an emotional response to a robot without worrying whether it's emotional itself.
Yeah, but nonetheless, you know that the actor is a human being, don't you? So you know that the actor is putting into a performance something that is based on their lived experience as emotional creatures.
Unless it's an animation or a CGI. So I think that these are blurred lines, and they're getting increasingly blurred.
Right. What about you, Hannah Allen, in terms of specializing in like telemedicine, consultations via text or video and so on? In other words, consultations across a link. How well, or maybe how not so well, can empathy work and reassurance and those kinds of things? How can it work in that context?
Yeah, I think, within normal sort of NHS practice, we're already incorporating, telephone consultations and things in the mainstay of our normal work. So within the NHS, it's already being implemented without the video, context of that, which actually brings in, a whole different sort of dimension when you're consulting with somebody over video. And actually, I think that you can actually use, there's a lot of empathy that you can gain from using that video consulting techniques. And I think that it's actually really, really important to utilize these types of methods with things like, social phobias, mental health conditions, where people don't necessarily want to leave the familiarity and the comfort of their own home. And they will consult much better, much more effectively, and have much better outcomes by being able to feel familiar and feel safe and feel happy when they're consulting, as opposed to having to go and physically see their doctor. So I think with that empathy element, I understand that there may be some confusion around how you might be able to convey that through the medium of video. However, I think it can be a very powerful source.
Catherine Allen, I suppose one definition of empathy is being able to put yourself in another person's shoes. And I'm thinking about the human doctors who treat us. Are there any ways that virtual reality can help them maybe better understand the experience from the patient's point of view?
Yeah, well, as I mentioned briefly in my talk, Torbay and Devon NHS Trust have been doing this for a few years now, where they've given doctors just very simple 360 video of what it's like to be a patient going through certain treatments, and that has really, really helped. It's helped them empathise with the patients. It's helped them spot sometimes quite what they would consider minor details about the environment that actually make a really big impact on the patient's experience. But now this is great, but they've done other things as well. For instance, patients have used VR to preview what a treatment's like to help relieve anxiety.
But I do want to talk a bit about trust, because I think that's very important. You know, trust both in the organizations that roll out all these healthcare apps or what have you, or the owners of these organizations. And Hannah Allen, I want to come to you with Babylon and thinking about, for instance, using an avatar as a therapist. And I don't know how far you're going into all that, but the idea that you sit at your computer and some virtual entity is consulting with you, and maybe you're somebody with a mental health condition, for instance, you're very vulnerable. That's ethically problematic, to say the least, isn't it?
Yeah, well, I think when we break it down and when we look at actually what people are using our services for, and when you bring that back to trust, I think that is really key. Whenever we think about what we're building, what products and services we're building, it has to boil down to what does the patient want and what do they trust in. And that comes back to implicit trust. So why implicitly do we trust doctors? When you go to your doctor, and if your doctor is off sick and you see a locum doctor, most people would implicitly trust seeing that new doctor, even though you've never seen them before. And that is because the process, the rigor, the academic rigor and the validation process is recognized by all of us to be accepted, and that doctor has gone through the necessary steps in order to receive the title that they deserve. And therefore, they have the capability to be able to diagnose and manage your conditions. But why do we not trust necessarily artificial intelligence and avatars and all of the ethics around it? And actually, if that is a reproducible model and we're able to make this, we're able to show the validation process, the post-market surveillance process, we're able to be completely transparent about how we build it, therefore, can we instill implicit trust in those?
Tony, what about trust with robots? I'm thinking now I'm a vulnerable, aged person, and maybe a robot is helping me with, say, some of my more intimate functions, like going to the toilet, for instance. Am I really going to trust a machine in those kinds of areas?
So there is going to be a long period, and I think it's going to be longer than perhaps people imagine, where we're developing these systems, and they're not perfect yet, and they'll have a lot of work to do to get better. And there'll be a lot of human-robot collaboration. So I think people imagine that they're going to be cared for by robots, and there's going to be no humans in the picture. I think there will be robot-human teams, and the carers will hopefully be able to do more of the human-to-human interaction, interpersonal stuff. The robots will take care of the physical side, and the humans would also be there to monitor the robots to make sure they're working properly.
And also I'm thinking about augmentation in the context of all the technologies that we're talking about on stage here. And it seems that, especially with augmented reality, for instance, and mixed reality, you can give us superpowers, can't you, Catherine? I mean, we can see through walls, or we can see through tissues in the body and so on. I know that augmented reality devices are great for training in all kinds of contexts. Where do you see them in the healthcare setting?
Yeah, it can give us a whole other layer on reality. So, for instance, augmented reality for doctors could be telling them what to do, or at least giving them some guidance or tips and hints without having to go and look at notes. I mean, I'm not a doctor, so I can't necessarily give some more. Hannah might be better to speak to this. But it can give you sort of, I suppose, live annotations, for instance, and I know that that's something that's being used with surgeons. So there's that from, I suppose, the perspective of a healthcare practitioner. But I suppose also, if we're thinking about personal care, there's all sorts of examples of where that layer over the top of our existing world comes into play. I suppose coming back to your question about data and trust, do we trust that organization who made that and those people to add an extra layer of understanding onto our reality? They are adding a lens, and I think it's important that we critique that, and we critique that sooner rather than later.
Yeah, and how about you, Tony Prescott? Because you take us into this whole realm, for instance, of brain implants, and you've already told us that we're cyborgs, so we're a good part of the way there already. But are we getting to a point now where we're going to go beyond like cochlear implants that we already have and similar implants for sight? Where next?
Well, I mean, they already have prototypes for brain implants that can control robot arms. So if you're paralyzed, then you could have some way of physically acting in the world. And there are people with replacement limbs, and there's interfaces for that into the nervous system. It may not be directly into your brain. It could be onto your chest and via nerves in your chest. So there are lots of of ways in to interface with the brain. What we don't understand is the code that the brain uses. And so these systems are relying on how smart our brains are in order to use the connectivity that we provide. So essentially, your brain is learning, oh, somebody's connected a robot arm to me, I can use this, and they would learn how to use the robot arm in the way that your brain as an infant is learning how to use a real hand. So if you can build the right kind of interface, the brain will learn to do it, just as you learn to drive a car, and it becomes part of you when you're driving it. So I think this is happening, and it will gradually happen more and more. There'll be wearable computers, interfaces. There may eventually be implants. I think at the point where you get implants that are cognitive implants, it gets really interesting, because if you could access content from the internet or from your smartphone just by thinking, then that's a great way of empowering your intelligence. But there's also huge risk there in that somebody can inject information into your brain. They can create false memories, and you can imagine a life that you never had and believe that was yours. So there's huge risks as well as great opportunities.
I think that's already happening, actually, with virtual reality. And there's a really interesting study that Stanford did. I don't know if you saw it, where children they were given this experience where they were swimming with orcas, and they were pre-elementary age. When they first did it, they came out of the virtual reality experience, and most of them said, I can't remember the specific statistic, but most of them did say, yeah, that wasn't real. But they asked them as time went by, and a few months later, over 50% of the children said, yes, I did swim with orcas. They had developed a false memory, and they'd even create stories around that to make it more plausible.
Yeah. Well, the nature of memory is that it reconstructs each time you have a memory. You rebuild and re-experience it. So in a way, they are just sort of taking what was there, which was a very realistic experience, and elaborating it a little bit, which is what we do all the time with memory.
But isn't it also the kind of subconscious memory of that as well? I think wasn't there a VR study that they put a headset on and somebody, as though they were a tree, and then for the following week afterwards, their paper use had gone down drastically.
Yeah, I heard about that, yeah.
So it's your kind of subconscious, what you don't even realize you're taking in, influences your lifestyle decisions.
Yeah, I heard about another study where people encountered themselves when they were older, or they were it was like a mirror, and you look at yourself aged.
Yeah.
And people afterwards were asked how much they were going to give to their pension. And they found that the amount that they were going to give to their pension went up if they'd seen encountered themselves as an old person.
Yeah, that
they
is
also
a
walk as an
perfect segue. I'm looking around here. This looks like quite a young audience to me. So you people are going to have to be looking after us, old lot, here on the stage. I don't want to judge the ages of the people on stage with me. I'm going down a dangerous road there if I even try. But I do want to come to you, Tony, just to think, because it is a serious problem, isn't it? And automation and robotics must be part of the answer about how we are going to be able to cope with and care for an increasingly aging population. And we're already seeing a lot of it in Japan, aren't we? Where people live to a ripe old age in Japan, and guess what? It's one of the big countries in robotics research.
Yeah, I mean, Japan have such a problem because they don't allow immigration, of course. So a lot of the care work in this country and in Europe is done by immigrants, and if you allow immigration, then you can correct this balance. So I think there's a whole lot of things that we can do to deal with this emerging challenge of the aging population. Robots, I would never say is the whole of the solution. I think we need to learn how to look after each other better. We need to learn how to live collectively better in ways that don't create isolation. And technology can work both ways there. It can isolate us. It can also bring us together. So we have to develop the robots and the VR systems in a way that they will increase that connectivity and human-human support. But I think that it's a win-win with robots, because people want to live in their homes for longer. If you ask them, they want to live in their own home. They don't want to be in a care home or a hospital. And it's much cheaper if someone lives in their own home than a care home or a hospital. So if you can make the home this environment that supports you to live there, using robotic technology, it's great for everyone.
Yeah, and Hannah, Alan, you were nodding, especially at the bit there where Tony said it's about the human at the end of the day. We have to remember that. It's very easy, and I'm sure I'm as guilty as anybody else. It's very easy to get hung up on AI and robotics and all this sexy stuff. It's putting the human right at the center of this whole discussion, isn't it?
Absolutely, really? And I think, AI has its place, absolutely. Technology has its place. I think from a kind of GP perspective, perspective, it can really help to augment, the efficiency and optimize the time that we spend, with our patients and what we can do with them, and the data that we can access and how that can influence our healthcare decisions. Plus, with the work that we're doing with regards to the digital twin, for instance, empowering the patient to see the lifestyle choices that they are making and how that affects their body in a longer term.
And really quickly, what is the digital twin? You mentioned it there.
So the digital twin is a technology that enables somebody to be able to actually visualize the effect that their lifestyle choices are making, their data is making on their organ health and their body health overall. And we're able to kind of visualize it not just in the present, but also to see how it's influencing your body in the future as well, with the idea that it empowers the patients to make better lifestyle choices.
Okay, so I could have a digital Gareth and see what happens if he takes up smoking.
Yes.
Or maybe drinks a little less, or whatever it might be. Okay, I shouldn't reveal too much. There's a doctor in the room. I might get told off. We've literally only got about 2 or 3 minutes left, but I'm going to cheekily see if we can take at least one audience question.
What do you say about VR experiences, befriending robots, etc., pulling people away from the physical world and causing them to lose connection with nature and society and communities?
Right, quick answer from Catherine Allen.
I've found it quite the opposite, actually. So we've put audiences through quite a few, you mentioned nature experiences, quite a few nature VR experiences, and we've seen when they come out, their feeling is, I want to go out and explore the woodland. I want to do this for real. It can give you that, when you've had that virtual experience of a reality, when you go and experience physically there, it gives it this extra magic to it because it's there and it's real and you can touch it. So in that example you give about nature, I found it the opposite. And I was concerned, to be honest, before we showed these nature VR experiences. We showed it to a group of nature lovers. They came out and wanted more in reality.
Well, thanks for listening, folks, and goodbye.